This presentation on opioid prescribing for acute care comes from the Michigan Opioid Prescribing Engagement Network, Michigan Open. Please visit michigan-open.org for more information. Pain management after acute care matters. It is an important topic for both patients and providers. In the following presentation, we'll go through tips for better pain management and better opioid prescribing after acute care. One of the most important factors in acute care prescribing is counseling patients and setting fair expectations. Setting expectations and norms about how much pain to expect and helping patients understand that for most acute pain episodes, the pain is limited and will get better day over day. In addition to opioids, many non-opioid pain medications can be used appropriately, including common over-the-counter pain medications like acetaminophen and ibuprofen, and these can be used regularly for the days to follow surgical or dental or care after trauma. It's important to counsel patients if prescribing opioids about the appropriate use of opioids, when they should be used and when they should not. In addition, patients should be counseled as to the common adverse effects of opioids such as constipation, nausea, vomiting, and potential for respiratory depression, as well as the long-term implications, including new chronic opioid use or potential for misuse and abuse. Lastly, for those patients being given an opioid as a part of their acute care, it's important to counsel patients for safe storage techniques and ensuring safe disposal following completion of that use. Studies show that there is no correlation between the amount of opioid prescribed and the likelihood of refill. While we certainly understand that providers are concerned about the potential calls for refill, prescribing less opioid after surgical and dental episodes does not lead to increased rates of refill. In addition, there's no correlation between the amount of opioid prescribed and people's satisfaction with their care. While satisfaction following acute care is an incredibly important topic, focus should really be placed on better customer service rather than increased opioid prescribing. Studies have shown that between 6 and 10% of patients after surgical care become new chronic users, and this could actually be considered the most common complication after elective surgery, and yet a complication that until recently wasn't discussed with patients as a part of their postoperative opioid prescribing. In addition, it is now recognized that almost 70% of what's prescribed after surgical care and dental care goes unused. This is important because these pills become common sources for diversion and abuse, including for vulnerable populations such as teens and adolescents, and accidental overdose in younger populations. Michigan Open, in collaboration with the Michigan Surgical Quality Collaborative, showed that opioids can be decreased following general surgery prescribing without ill effects for patients. These data showed that there was a month-over-month decrease in prescribing following the surgical care. However, after releasing specific guidelines for opioid prescribing for specific surgeries, there was a significant decrease to follow, such that immediately before these data and soon to follow, there was a more than 30% reduction in prescribing and without any meaningful change in satisfaction or pain. Satisfaction following the care remained high, and pain remained low and well managed following this care. And again, this was for more than 35 hospitals and almost 8,000 patients. Michigan Open has a number of resources available for providers on our website. These include procedure-specific recommendations for opioid prescribing. These prescribing recommendations are updated regularly, including the new prescribing recommendations as well as updates to existing prescribing recommendations based on new data. We also have best practice prescribing recommendations that we've made in partnership with the Michigan Department of Health and Human Services. To learn more about these recommendations, as well as to obtain patient materials and information for your patients and providers, please visit michigan-open.org. Thank you.